thanks, Krista, for having me. My name is Baiju Shah. I'm an endocrinologist at Sunnybrook Health Sciences Centre in Toronto, and I'm a researcher and professor at the University of Toronto.
You do a lot of work to ensure that there is diversity in research. And I wanted to ask you about why it's so important that we have diversity in research.
What my broad research program has done over the years is really to try and understand where there are gaps in care for people living with diabetes.
Some of the things that you've done are really transformative in the way that I think about how we reach people. And I wanted to touch on one particular study that you did with Dr. Ananya Banerjee, which I found so insightful.
Lessons from that work is that we shouldn't just paint everybody with the same brush. When we do our work with First Nations communities, there are differences between different nations and between First Nations people living in community versus living in urban areas, for example. When we look at lower income communities, it's the same thing. People's circumstances can be different, and their access to care and their outcomes of care can be different just depending on the context. So I think it's just important to remember that you're always generalizing. But that doesn't mean you shouldn't it's still important work. It's still important to think about it. It's still important to recognize that those gaps are there, those disparities are there, but not forget that none of these groups is homogeneous.
Do you have any advice for researchers or healthcare providers that are thinking about doing this work, about how to work with communities that might not be your own, or how to respectfully be a part of research projects that involve communities that aren't your own?
I think you have to work with the community, understand what their priorities are, understand what research questions they want to ask and they want to answer, and work with them to do that. You're bringing the skills of the research, but they're the ones who have the lived experience and understand what it's like to be in that community and have diabetes, or be in that community and see where the disparities are. So having that respectful engagement and that back and forth, that quid pro quo, where people are on both sides feeling like they're benefiting from this relationship and getting something out of the work that you're doing together collaboratively, I think is really, really important.